Good morning, everyone. Hello and welcome to another edition of Peter Abigail Foundation's Let's Talk series. Thank you for taking the time to join us today. Our mission of the Peter Abigail Foundation is to encourage and empower immigrants achieve their dreams by making them aware of government incentives and resources available, particularly during times of need, to help them achieve their goals and improve their well-being. Our vision is to provide information, organize seminars, webinars, and retreats to foster inclusion through community involvement and collaboration, curating and sharing essential resources for immigrants. We encourage immigrants to engage more actively in commerce, business, politics, and other sectors, while promoting the involvement of religious organizations in supporting their congregational welfare. We assist individuals and groups in assessing key services, especially in the social sector. Additionally, we highlight the achievements of immigrants in the diaspora. Today's webinar, titled Immigrant Health, will be delivered by Dr. Moronkeji Fagbemi. He is going to give us insights on the current health situation of immigrants in the United States, among other things. If you have any questions, please feel free to click the chat box and drop your questions. Our guest speaker will make time to answer them at the end of his presentation. Thank you. About our guest speaker. Dr. Moronkeji Fagbemi is a double board certified physician in internal medicine, preventive medicine, and addiction medicine. He is an attending physician in the departments of medicine and psychiatry at Bronx Care Hospital in the Bronx, New York, which caters to a multicultural community, including many immigrant communities. Dr. Fagbemi is an assistant clinical professor of medicine at the Icahn School of Medicine at Mount Sinai. He's a fellow of the American College of Physicians and a fellow of the American Society of Addiction Medicine. He has over 34 years of medical experiences, which span academic medicine, clinical practice, education, and research. He is an advocate for primary care and preventive medicine. He is a speaker at local and national medical conferences and is well published. Dr. Fagbemi regularly gives health talks to various community groups and coordinates the health fair for his local church community. He is a Christian minister and the director of Christian education at his local church. Dr. Fagbemi immigrated to the United States about 32 years ago. He is happily married to the love of his life, and the marriage is blessed with 3 adult children. Thank you.
I just want to thank everyone for giving their time this morning to come and be part of this talk. It's an important talk to everyone, and particularly to the immigrant community. Someone said health is wealth, and that is true. So today we'll try and go through some things. Of course, the time we have is not enough to exhaust everything about immigrant health, but my hope is that it will be more of a talk between us and to highlight some things rather than just a lecture. And like this, and as we were told earlier, we will have some time to ask questions and hopefully get useful answers to those questions. So at this time, I'm going to share my slide, and I'll go from there. So can you all see my slide?
Yes, sir.
Okay. Thank you for the, so I have no disclosures or conflict of interest concerning what I'll be saying today. And basically, the talk is to help us to understand how to better live healthy and not meant to replace the advice of your doctor. One of the things I'll keep on highlighting is the fact that everyone has a different family history, health risk, and past medical history, which must be discussed with your healthcare provider so that they can tailor your medical treatment for optimal results and benefits. Most of the things we're going to be talking when we're giving guidelines, when you see bodies, medical bodies giving guidelines, most of the time they are talking to the person that has what we consider average risk. Sometimes we do delve into people that have additional risk and what their screening should be or what they should be doing. So it lets us understand the fact that everybody is different, and that's the reason why you need to sit down with your healthcare provider to discuss about the peculiarities of your life so that they can tailor your health to give you the best result. So some areas we're going to focus on today will be terms to know, including what is health, the causes of death in immigrant populations. We'll talk a little bit about perinatal health because that's important. Then maybe say some few things about mental health and talk about also citizenship, immigrant services, medical exam. And we end with talking about how do we, what about prevention, keeping us alive and healthy. So we hope you benefit from this. So just some terminologies to go through. First of all, for the talk today, when I'm talking about immigrant, I'm going to be talking of everybody that encompasses any non-citizen in the US and first-generation immigrants. So when anybody that falls within that will be what I'll be referring to as immigrants. I know they have a definition, legal definition of what an immigrant is, and that's what I put in there. Legally, the country has considered that immigrants as individuals are admitted to the United States as lawful permanent residents and people that intend to come and settle and they are admitted through the normal process. But for the sake of this talk, anybody that is here, whether they are migrants, they are asylum seekers, refugees, undocumented immigrants, unaccompanied children, will fall under the term immigrant in this talk, just to highlight that. So this slide is talking about the top countries that have US immigrants, and you can see there. I know many people are from Nigeria. We're down here at 444,000. Just some data about that. So when we talk about first generation immigrant, just some definitions to clear out the ground. What do you mean by first generation immigrants? It's someone that is born in one country and later moved to another country. So I will consider myself as a first generation immigrant. So this person is a pioneer, is the first in that family to live in that country and haven't come from somewhere else. They are distinct from those that are born in the country to immigrant parents. These are called second generation immigrants. And then those that are born to two native born parents are third and so forth. So those are terminologies that we might be using as we go on. Just a reminder for people that America is a country that was founded by immigrants. And so it's important. That's why this topic is even of importance. So what is health? Well, health, according to the World Health Organization, is defined as a state of complete spiritual, physical, and emotional well-being, and not just the mere absence of disease of infirmity. So when you ask people many times, are you okay? Well, I don't have any cut, I don't have any disease, I'm fine. But health is more than that. And even there's a part of it called social health that was made evident during the time of COVID. That was really, really evident during COVID. And we saw during that time that the incidence of depression and a psychiatric condition did increase because of the social isolation that people did have. So health involves every component of the human body, spiritual, physical, emotional aspect. And this, the next slide is talking about the different parts. So the part shaded in yellow is part that most people think when we are talking about of health. Okay, well, do I have blood pressure? Do I have any bones aching me, and etc. Once I don't have that, I think I'm healthy. But we all know now that there's more to that. There's mental health, there's emotional health, their social health, and all these work in tandem. They affect each other and they affect the well-being of the individual. So let's start from the good story, and that's the fact that there's what we call the healthy immigrant effect. Healthy immigrant effect. This refers to the observation that immigrants often arrive in the new country with better health than the native-born population. Contrary to many things that we hear on social media and TV, that's usually what happens. Part of this we'll see as we go on. But we found that these advantages, or the advantage that they have of coming with healthy immigrant effect, diminishes or disappears over time as they spend more time in the new country. And we see that diminution of the effect when we look at different metrics such as the mortality rates, how often they're hospitalized, and even in self-reported mental health. So that's why we're also talking about doing this talk, so we can understand this and keep the advantages that we have. Several factors are involved in healthy immigrant effect, and that's the fact that, first of all, most countries have a screening process, and so they tend to screen the healthy ones to come to their country to settle permanently. So that's also one of the reasons. And the other thing is that people usually come in younger and healthier to other countries, and so that also is one of the reasons whereby we have the healthy immigrant effect. And when they come, many times they come with healthy behaviors in terms of activity level, in terms of dietary preferences, and like I said before, they usually come in at a younger age. So all those things are the reasons why you have the healthy immigrant effect, and people come in are usually more healthier than those that are native born. So then we come to second generation immigrant health. Well, studies have shown that there's often a mixed experience when you look at the health in terms of the health advantages and disadvantages compared to both their immigrant parents and the native-born population. While the second generation initially inherits some health benefits from their parents, the healthy immigrant effect, like I said, this can diminish over time as they adopt unhealthy behaviors and norms of the new environment. So those are the things that do cause the second generation sometimes to lose some of the advantages that they were born with. But all these things that we're talking about, they are actually affected by many other things, including socioeconomic status, the cultural background of where the immigrant is from, their access to healthcare. All these are things that play a significant role in their being healthy and whether they have a rapid whether they have a rapid decline in the healthy advantage that they come in with. Talking about substance use disorder in the United States, we found that also according to several researches, one of them is that of Wright et al. They found out that using the National Epidemiologic Survey, they found out that immigrants, contrary to what we hear on TV, immigrants are found to be substantially less likely than US-born individuals to be diagnosed with substance use disorder, including alcohol, marijuana, cannabis, cocaine, or opioid use. And they found out that this projection just holds across all world regions, whether the immigrants are from Africa or from Asia or other parts of the world. They found out that this pattern actually did exist with immigrants and was seen among the top 10 immigrant sending nations. So we see that matrix, whether you're talking about the age, the gender, family income, age of migration, and time spent in the US. When you compare that with the native born, you find that those immigrants are found to have substantially less diagnosis of substance use disorder compared to native born. Also still talking about the study, we also found out that the prevalence of substance use was highest when you compare the first generation immigrant to second generation immigrant to now native born, we found that the prevalence of substance use was highest among the native born Americans, slightly lower among the second generation, and markedly low among the first generation immigrants. So I just want us to have some of this idea, because many of us hear other things in the social media that gives us a different perspective about immigrants and their health status. This pattern again holds true for all regions of the world, whether you're talking about immigrants from Asia, Africa, Europe, or Latin America. So what are the potential advantages for those that are in the second generation? Well, one of the things that they are privileged to have is they have healthy immigrant effect passed down. Many at times there's positive economic mobility in which they already have a foundation for which they can leap from economically, and hopefully they are able to incorporate some of the healthy lifestyles that from the part of the region their parents came from, and also imbibe some of the healthy lifestyles in the country where they are born. So there are important health lifestyles that you can also imbibe from. Say, for example, you were born in America, there's some healthy lifestyle you can also incorporate into your life to actually make the advantage even better. Also, cultural adaptation, including adopting healthier choices in the host country, which is what I just said. What are the potential disadvantages for the second generation? Well, with the disadvantages that we see is that many times we see erosion of the healthy advantages that they have. So that leads to them having sometimes higher rates of chronic diseases or mental health issues or other problems compared to their parents. And I know I did invite a lot of young folks here because I wanted them to hear that too. This is not a talk for just people that are first generation immigrants. I wanted the first generation, second generation, third generation to hear this, because this has to do with every generation. So these are the things that we want you to build on and actually be better in terms of your health. Also, the fact that there are certain disadvantages to second generation, especially if there's poverty or low parental education, or on things like unstable housing. Those are some of the things that may also pose as hurdles or potential advantages to second generation health. Also, things like insurance status, lack of culturally competent care. One of the things I always tell people is that, especially if you have health challenges, you want to be sure that you are being managed by someone that's culturally competent. That means they understand what the disease you have and how maybe your race and genetics, etc., kind of affects it. Because if you don't have a culturally competent person taking care of you, sometimes you might not get the optimal treatment. They might not be exposed to how often they're supposed to screen you, the risk that you have, and also the type of medication that will be best for you. So I'm going to talk briefly about some deadly myths and errors that people have. There are 4 of them I listed here. One is that I don't need to know about my family health history. That's a bad thing not to know. Or some people, when they go to a doctor and they ask them about their family history, they write no, 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 and they even pray and I reject it, and etc. It doesn't show spirituality. It actually puts you as an advantage, because when you don't tell people your family history actually is one of the first defenses that you have in knowing what are the potential things ahead that can cause problem for you. And so you can actually start taking care of them ahead of time. If you're in a family whereby diabetes is rampant or hypertension is rampant, and you don't, and you just say you reject and you don't pay attention to it, taking care of some of the risk factors, then don't be surprised if down the road what happened to your parents or grandparents starts happening to you. That's the reason why we need to know this family history, so that whoever is taking care of you can know how aggressive they need to screen you, what are your risk factors, and etc. The other thing is, other myth is that what I don't know cannot kill me. Well, we know that what you don't know can definitely kill you. Most of the bugs that do cause problem, we can't see with our naked eye, but God forbid, when they enter your body, they can cause havoc. So that's not true. Ignorance actually kills. Ignorance kills. The third one is that you can't die before your time. Well, yes, there's what you call premature death. And so if you don't take care of yourself, if you don't take care of things that you should have taken care of, they can cause premature death. And so that's also a myth that we need to throw out of our lexicon. Lastly, there's this myth that the doctor's office brings diseases on you. No, doctor's office doesn't bring disease on you. They only highlight what has been there or what is cooking up in your body that you don't know or you are ignoring. So I want us to just have that back of our mind so that we don't we have the right perspective to health checkups. Here is a slide that's talking about average life expectancy in certain countries. I put in here about 7 to 8 countries. You can see in the United States, the average life expectancy for males are 76.8. It doesn't mean that every male is going to die. That's just the average. There are people that are living longer than that. Females, 81.9. And average, if you put male and female together, it's about 79.4. Now, compared to a place like Nigeria, we can see that the average expectancy is about 56 years. And down, you can see other countries there. I also tried to put some countries from Africa here: Algeria, Tunisia, Egypt. These are their life expectancies in those countries. And in the Caribbean, you can see you see like Barbados, life expectancy about 80, and some other countries there. So later on, you can find out what it is for your country. So what are some potential hurdles immigrants have in their health? While sometimes we show that they have a better overall health, starting off with a healthy immigrant effect, they also face significant health disparity and challenges that can include limited access to care. That might be because they don't have insurance, so insurance gaps might be one of it. Barrier to navigating the health system, they don't know how to go about it. Who do I meet? So many times people wait until things go bad before they actually are forced to go and seek medical care. Language barrier is also that. If people can't express themselves, they may find it difficult to be able to tell people what is actually happening to them, and that will affect the way that might affect the diagnosis and also treatment. Cultural differences, immigration policies, because as we are seeing what is going on now, many people are afraid to actually seek medical help. Even those that are pregnant, they don't go to seek medical help, and that is not good at all. But those are some of the things that people can face and act as hurdles. Chronic diseases we talked about. Immigrants are also at risk for chronic diseases like diabetes, hypertension, and heart disease. And this can actually be made worse by limited access to care and unhealthy living conditions. Okay, we found that migrants, particularly in North Africa and North America, in the United States, have a higher prevalence for diabetes, for example, and that has been found to be a cause for many other things, including kidney disease and heart problems, and etc. Much of this we find that is because of a shift from healthy lifestyle changes that they came in with, dietary shifts from eating fresh, healthy foods to now eating fast food, to stress associated with immigration, which also has its own effects and wreaks havoc on the body. We also found that migrants can experience higher rates of cardiovascular disease. And when we look at the causes of death for immigrants, we find that the most common causes of death are usually cardiovascular, cancer, and respiratory diseases. Okay, but if you want to dive into the weeds, there may be specific causes, and the prevalence might vary depending on where the immigrant group is from and their country of origin. And like I said, other factors can also factor in, including access to healthcare, what is their socioeconomic status, and also the health behaviors. So talking about the top causes of death, I have here 10. We're not going to go through all of them. I'll just highlight about 3 or 4 that are very prevalent in the immigrant population. So we see number 1, heart disease, cancer, unintentional injuries. We talk about that later on. Stroke, chronic lower respiratory disease like COPD. Okay, Alzheimer's. Silently, Alzheimer's is killing people. I'm sure you may have heard about one of someone that died recently, that died of kind of Alzheimer's, kind of dementia. There's different kind of dementia. Alzheimer's is one of them. Okay. Diabetes is also one of the leading causes. Kidney disease, chronic liver disease, and of course, COVID is not yet gone. Here again, talking about the top 10 causes and how many people they kill every year. So heart disease kills almost 700,000 people yearly. Cancer kills over 600,000 people yearly in the United States, okay? And so forth. So let's start with heart disease. So about close to 700,000 people die of heart disease in the United States every year. That is 1 in 5 deaths, okay? Basically, a heart attack occurs every 45 seconds. And in the United States, someone dies from heart disease approximately every 34 seconds. Okay. So what also makes it worse is the fact that 1 in 5 of those heart attacks is silent. That means damage is done, but the person is not even aware of it. Okay. So what are the symptoms of heart attack that we can see? Usually, if it's typical, is pain or discomfort in the chest. This might go to the neck, the jaw, or the back. You might feel lightheaded or faintish. Sometimes the pain might also radiate to the shoulder or the arms, and associated with shortness of breath. Other symptoms that we call it typical symptoms can occur whereby you suddenly feel tired. Sorry. So sometimes you feel tired with nausea and vomiting. And this type of atypical symptoms, we find that commonly in women. So when you have symptoms like that, please, it might be time to seek help. Don't just think it's indigestion or you ate too much or something. It might actually be something worse. So talking about the different areas again, chest pain that might go to the jaw, that might go to the shoulder, shortness of breath, might feel very tired, lightheaded, or you might actually have nausea and vomit. Hypertension. Well, high blood pressure is a risk factor for cardiovascular disease and stroke, the 2 leading causes of death in the United States. Studies have shown that now that about 50% of males age 20 and older have fallen into the definition for hypertension, especially when you adjust the age. And in the case of women, about 42% of those age 20 and older have hypertension. So, and the thing is that the rate increases as you get older for both men and women. So we're talking about blood pressure. Again, these are guidelines for the average risk. Depending on what condition you have, you might need to sit down. You need to sit down with your healthcare provider, and they will actually have a goal for you. Okay. Some people may have to go lower in their blood pressure. Some people might be given latitude to be at a little bit higher pressure, but that you have to work with your doctor depending on the conditions that you have. But generally, this is where you want your blood pressure to be. Normal should be 120 systolic. That's the one above, and then the one the right lower down. That's what's called diastolic reading should be less than 80. When people start having ones going to the yellow column, 120 to 129, well, you should start thinking about doing something about your blood pressure. Otherwise, it will start going down towards the red. Your doctor may tell you to start losing weight, watch this amount of salt you take, and maybe increase your activity level, and etc. And as time goes on, if that is not working, then you might be given medication to help with keeping your blood pressure down. So risk factors for hypertension includes obesity, diet, high salt intake. Why we tell people that eating fast food and all those stuff increases, apart from the fact that they use other stuff that involves high cholesterol, most food produced outside and maybe frozen and you have to take care of usually contain high salt content just because they want people to have a good taste. And so if all your food is done from outside, that's going to be a real challenge. Unless you have someone that's actually cooking and you can tell them, well, you don't want salt, that you're going to add your own salt by yourself. Family history of hypertension, excessive alcohol use, lack of physical activity. If you are Black or African American, it's a risk factor for hypertension. And of course, cigarette smoking or tobacco use is a risk factor for hypertension. Diabetes, about 34 million or over 34 million people have diabetes in the United States. 29 million know that they have it. About 8 million don't know that they have it. It's amazing how many people don't know that they don't have diabetes, that they have diabetes. And the percentage tend to increase as people get older, reaching up to almost 30% by the time people get to age 65. Okay, so when you take away the American Indian and the Native Alaskan, the next group that has the highest deaths of diabetes are non-Hispanic Blacks, okay, of which we fall into, okay? That's about 12.5%. Those from the Caribbean region can even have higher prevalence of diabetes, okay? And in some areas as high as 18, almost 19% in adults that are over 25 years. So people from that region should also take note of that. So what are symptoms of diabetes that we see? Well, things like frequent urination, you always go to the bathroom, you feel thirsty, you feel hungry even though you are eating. That's because even though you are eating, the sugar that's from the food that you're eating is just there, but it's not getting to your cells for energy. So the cells are still starved of food, even though you are eating all this food. And so feeling fatigue, blurry vision, cuts and bruises that are slow to heal, weight loss even though you are eating more, that can occur especially in type 1 diabetes. Tingling, numbness in your feet and hand are also signs that can occur with diabetes. If you have any of those, you should get checked up for that. For females, frequent vaginal yeast infection may also signify that. So what are the diagnoses of diabetes? Well, normally when you go for the checkup, they do blood tests. They usually tell you to come fasting. That means they don't want you to eat anything after midnight, and so you come in fasting. And so they take your blood to check your sugar, but they also check things like hemoglobin A1C. Everybody should know that for themselves. So the normal for your hemoglobin A1C should be between 4 and 5.6. When you do fasting blood sugar, your glucose should be less than 100. When it starts getting between 5.7 to 6.4, we call that pre-diabetes. So that means your body is warning you that you need to do something, or else you're going to become diabetic. This time you need to work on, or if you do your fasting blood sugar and it goes between 100 to 125, that's also telling you that the way your body is handling glucose is a little bit impaired and you need to do something about it. Once your hemoglobin A1C is about 6.5, or you do a fasting and your blood sugar is 126, then that's referred to as diabetes. And you might need to be placed on, apart from dietary changes, you might need to be placed on medication. Other things that you need to take care of if you are diabetic is you go for regular checkup. That includes eye test and checking your feet. It's amazing how many people don't do that, and as time goes on, they lose their limb or their eyes get so bad that they lose eyesight. So you want to keep on checking your eyes. Follow your diabetic diet, do regular exercise as tolerated by your age. Keep well hydrated because the water kind of flushes out excess sugar also. Be compliant with your medication, okay? And check your blood sugar as advised by your doctor. Even now they have monitors that you can actually place on your skin that monitor 24/7. That's good, and you have to just change them every week. Don't wait until your food becomes bad. These are some examples of people that have diabetes has become so bad that it's affecting the blood supply, and because of that, they either are having part of their feet dried up, or they have sores that cannot heal well because they're not getting blood supply, nutrients, and also white blood cells to fight the infection. And that usually leads to them being amputated. Since we are talking about diabetes, we'll just talk a little bit about gestational diabetes. That is diabetes that occurs during pregnancy. So studies have shown that many immigrant women, particularly those from Asia, Africa, and Latin America, have a high risk for gestational diabetes compared to women born in the host country. That's something that we need to keep an eye on. The risk actually is shown to double for risk for women from the Caribbean and East Asia Pacific, have a quadruple and quadruple for those from South Asia. So that's another reason why when people are pregnant, we should encourage them to go for prenatal visits so that these things can be caught on time, and hopefully modify the patient's outcome. Why is this important? Well, first of all, what's gestational diabetes? That's when you have abnormal glucose levels during pregnancy, because when people are pregnant, they release a lot of hormones that tend to increase sugar, because now you are trying to feed two mouths, both the mother and the baby. So your body needs sugar, but those hormones that make your sugar go up, you may not have enough counter hormones to take care of the sugar, and so the sugar goes very, very high. So you may not have enough insulin to take care of it, to take care of the excess sugar, and so you have the excess sugar. But this doesn't work in isolation. Because of the excess sugar, it does have effect on the woman and also the process of pregnancy. Those that have gestational diabetes, they found out that if nothing is done about it, they tend to move in the direction of type 2 diabetes within 2 years of giving birth. And there's also increase in the adverse effect that occur with the pregnancy. They have increased incidence of having preeclampsia, you see, high blood pressure during pregnancy. They end up having big babies. That may also lead to cesarean section. And they also found that the infants that are born have an elevated risk or higher risk of metabolic disorders later in life. So that's why we should pay attention to this stuff. Talking about stroke, we move on to stroke. Stroke is a brain injury. Just like you have heart attack, it's like, I call it, it's a brain attack, whereby a part of the brain is blocked off, and it can't get enough oxygen and nutrients to help it live. Up to almost 800,000 people experience stroke every year in the United States, of which over 600,000 are first-time strokes, while about 185 are recurrent stroke. That means they've had stroke before and now it's just coming back again. Another episode. So in all, about over 160,000 people die of stroke. So there are different types. It could be because the blood vessels are narrowing, and so like the first picture that we have here on your right, that's the narrowing because of atherosclerosis. That means fatty deposit within the blood vessels supplying that area. It's become so narrow that it gets blocked off. Or you might have what you call hemorrhagic stroke, whereby it just bursts open, and that's usually very catastrophic. Then you have one in which you just have a clot. Either the clot is formed there, or it's formed from other places, from another place in the body, and then gets trapped in the blood vessels to that part of the brain. All in all, what happens, whichever one happens, is that anywhere behind this blood vessel doesn't receive the oxygen and nutrients that it needs. What are the things? When you see certain things, you should think stroke. And the ability to reverse and treat stroke is very, very time sensitive. You want to try and get the person. This is not a time if you see these signs, you don't say, well, you go and see a doctor or see someone tomorrow morning. No. You see these signs, you get the ambulance there and get the person to the hospital ASAP. So things like balance, if you have loss of balance, so the acronym is BFAST, BEFAST. B stands for balance. If you're having problem balancing, suddenly you are having blurry vision, or maybe a part of the face suddenly droops. You look at yourself in the mirror and one part of the face seems as if it's not equal to the other part, or one of your limbs, the arm or the leg, suddenly becomes weak, or you have difficulty speaking. If you see any of those, then the next thing is time, which is to call the ambulance immediately. You do not want to wait any minute. So some healthy numbers that we should know. You want, like I said, these are for average risk. Okay, your doctor will tell you whether you even need to be more stricter with this value. So at least you want your cholesterol to be less than 200. Your HDL, which is the good cholesterol, want to be above 45. Preferably, the higher your HDL, the better for you. That's the cholesterol that takes the bad cholesterol out of your system. Then the bad cholesterol, which is the LDL, we usually want it to be below 100. So people, if they have coronary artery disease already, their doctor may push for a lower value, like even 70 or below. You want your fasting blood sugar to be below 100, like we said earlier, and your blood pressure 120 over 80 or below. Also, we call something BMI, which is talking about your weight to height ratio. And and here we have a diagram that you can use at your own time. It shows you what your weight should be concerning your height. So if, for example, you are 5'6", for example, you want to be in the green. The green is the healthy. So here, all you have to do is trace that 5.6 to here. So you really don't want to be more than like 155 pounds if you are that height. Cancer is another major cause of mortality, cause of death in immigrants. And 3 cancers that cause the most death globally are lung cancer, colorectal cancer, liver cancer. But briefly, you can see that the breast, lung cancer, prostate cancer, and colorectal cancer account for 50% of all new cancers in the United States. And the good thing about it is that there are screening tools for these cancers. Okay, just for us to know. This is also a diagram showing new cancers and the ones that are the prevalent ones and cancer deaths, what is causing cancer deaths. So lung cancer is the second most common cancer in the United States, but the leading cause of cancer deaths. Okay, the primary risk factor for lung cancer is smoking, tobacco use. And so if you have that, you should try and go for treatment so that can help you to stop smoking or taking tobacco. And if you have smoked but you stopped, then you still need to talk to your doctor about the fact about screening, because they have what they call low dose CT scan screening that can help you screen. And if they can see something early, they can take care of it before it becomes too late. Another thing to talk about lung cancer is it's not just the person that smokes, but secondhand smoke. If you're living with someone that is smoking, we call it secondhand smoke. It also increases your risk for lung cancer exponentially. Or if you are working in a place where people are smoking, and that's why they passed a law that people cannot be smoking where you are working. If they want to smoke, they should go out, because we found that it's not just person that is smoking that is affected, but there's what we call secondhand smoke that can occur. Also, occupational exposure to asbestos is something that can also increase risk for cancers, lung cancer. So the symptom for lung cancer can vary, but things like coughing off of blood, chest pain, shortness of breath that's persistent, fatigue, because now you can't exchange oxygen very well, and so you get so fatigued easily. Hoarseness, weight loss, those are some of the signs that people can have. If you have any of this, you should see a physician to check you out. Colorectal cancer, it's when you take away skin cancer, colorectal cancer is the third most common cancer diagnosed in both men and women in the United States. Okay, and over 100,000 of new cases occur. So one of the things that is really fascinating about colorectal cancer is the fact that they're screening different forms of screening to detect colorectal cancer. They even have this Cologuard that they show on TV. That's for someone that has an average risk. That's why you need to see your doctor to know what is your risk level, because there are some people that Cologuard is not going to be enough for. They will need to have a colonoscopy. Okay, if your health insurance allows you to have a colonoscopy, that actually is the gold standard that you want, so that they can see inside of your colon and actually remove precancerous polyps if they exist. Okay, the screening recommendation for adults is 45 years and older, but it also depends on what is your risk factor. If you have certain bowel conditions like uh, like inflammatory bowel conditions, okay, that might put you at a higher risk, and you might need to be on colonoscopy and have it more frequently. If you have a family history whereby you develop certain precancerous polyps, that might mean that they may have to screen you even much earlier than the recommended limit. So these are the important things that we need to know. It's individualized medicine. You need to know what's your family history and speak with your doctor for them to give you the best guidelines. But generally, it's age 45 and older. What are the symptoms of colorectal cancer? Things like constipation, um, weight loss, anemia, blood in the stool, feeling full every time, feeling like the rectum is not completely empty after you take a bowel movement. Those are some of the signs. I'm going to move faster now. Prostate cancer is the most common cancer among men, apart after skin cancer, but can easily be diagnosed and often treated successfully. Okay, so the way it's diagnosed is basically people come with symptoms. Sometimes, many times, it's actually asymptomatic. That means people have it, but you don't know. But you can go to a doctor and they do a rectal exam. They do what they call a PSA, and it's a blood test. And based on those results, they can decide whether they're going to do a biopsy. So this diagram on your right is just showing what a normal prostate is, and when people have prostate cancer, some of the things you can do, which is to obstruct the urethra, which is the tube that passes urine from the bladder to your penis. And when that occurs, people have difficulty peeing, they pee longer, they may have blood in their pee, and it may also lead to you having infection because the pee also is redirected in the opposite way, and so you may not empty your bladder as well as you're supposed to. And when there's fluid there's not supposed to be somewhere, bacteria tends to gather in it and can cause problems. So prostate cancer, basically, those are the way they present. One thing I just want to highlight is that men from West Africa ancestry are more likely to have genetic variant associated with prostate cancer. So that's one of the things as immigrants that we need to know, that basically many are at high risk for this, and so it should be part of your checkup. Generally, you start screening at the age of 50, but those that are high risk, like Black men and those with a family history, should consider starting at age 45 or even 40. So there are many different guidelines from different bodies, but these are guidelines that are more specific concern depending on what risk factors.
I got here like around like 12:30.
Sorry, someone has to mute themselves. Sorry. Breast cancer is the most common cancer among women in the United States. Actually, about 1 in 8 women will develop invasive breast cancer during their lifetime. And the good news is about 3.8 million in the US are breast cancer survivors. The main thing is early detection. So people need to go for screening. Don't be afraid to screen. Screening doesn't bring the cancer, it just detects it, and so it can be gotten early and you can do something about it. Okay, so there are different recommendations by different health bodies, but according to the American Cancer Society, you should think of starting your mammogram as early as age 40. Again, if you have a family history and genetic predisposition to that, to breast cancer, you may actually have to start much earlier. So these things, again, these are general guidelines, but when you sit down with your doctor, depending on what is going on in your family and etc., that can determine whether you need to even go much earlier. Cervical cancer. Some might say, why are you talking about cervical cancer in the United States? Well, we have to talk about it because we're talking about immigrants. Okay, there's some important information that we need to know. So cervical cancer is the most frequent diagnosed in women that are between 35 and 44 years old, and rarely develops in women below 20. Okay, one of the things that's also associated with it is what they call HPV, human papillomavirus, which if people have that, it increases their risk of cervical cancer. The fortunate thing about it is that cervical cancer is both preventable and curable if you get it early. And that's why people need to go for their pap smear screening. We should encourage our women and our daughters, our mothers to go for their screening. Okay. The other thing I wanted to highlight is that in Nigeria, cervical cancer is a significant health concern. In fact, it's the second most common cancer. Okay, it's the second most common cancer and second leading cause of cancer-related deaths in women between age 15 to 44. Okay, so people need to go for their pap smear. So if you can imagine if someone's coming from Nigeria and they're immigrants and they don't want to go for their pap smear, they should just know that they're at an increased risk. Okay, one of the things that we should need to start advocating is about getting our children vaccinated with HPV vaccine. Okay, and this is not just for the women, the HPV vaccine is also for the men. Okay, my kids had it. Okay, I encourage people to have it because it will help. Okay, so here are the guidelines for women. Okay, if you're doing your pap smear as often as you're supposed to, at least every 3 years for those that are 20 to 30, and pap smear with HPV. Okay, so another option. These are guidelines from the American College of Obstetrics and Gynecology. Okay, now they talk about age 65 no testing. Well, this only will apply after sitting down with your doctor. Okay, you should consider stopping it at 65 if you have never had any abnormal cells, you don't have cervical cancer, and you have had 3 negative tests in a row. And even then, you still have to discuss with your doctor because we find that people live longer, their health status changes, and so their sexual habits changes. And so it's a long time between age 65 and someone that's going to live till the age of 85. Okay, that no testing after 65 is something that we need to really discuss with your doctor. So when it comes to cancer, the key thing is prevention and early detection is the key to better treatment. So let's move on. I put in a health quote here. It says, sadly, health is not valued till sickness comes. Okay, we need to learn to value our health even when we don't have obvious sickness. So we move along. So I put in here medical checkup and prayer should complement each other. Okay, prayer is good, and in fact, it's essential in life. But prayer is not a substitute for medical checkup or perinatal care visits. Okay, I'll say that again. Prayer is good, it's essential. Okay, Bible talks about that we should pray always. Okay, in fact, let your life be a sandwich of prayer. You pray, you act, and then you pray on top of that. That's where life should be. Okay, we pray so that we can put it in God's control. We pray so that we can get direction. Then we move with action, and then we pray with thanksgiving, and also pray on what the things that we do that to be successful. Okay, that's how we do it. Prayer is not a substitute for you doing what you're supposed to do. In Jeremiah chapter 88, chapter 8, verse 22, I have the same quote from different parts of the Bible. It says, is there no balm in Gilead? Is there no physician there? Why then is there no healing for the wound of my people? If you actually read that part, you find that it's not just talking about physical wounds, but also emotional wounds. Okay, is there not healing? The other one from the Message Bible says, are there no healing ointments in Gilead? Isn't there a doctor in the house? So why can't something be done to heal and save my dear people? I just want us to have that at the back of our mind that spirituality, health, prayers should complement our medical checkups and not be used as substitute for them. We talked about intentional injuries as being number 3 on the cause of death. What do you mean by that? Well, these are the things that are the major things on intentional injuries. Poisoning. It's not just it's not talking about someone poisoning another person. We're talking about people overdosing because of using drugs, Opioid use is a major thing. Alcohol can cause that too in relation with opioid, with other drug use. Okay. Falls, a single cause of death, especially among older people, 60, 65 years old, to start getting to that age range. In fact, in the year 2021, over 39,000 older adults died from unintentional falls. So that's why you want to make sure that the shoes you wear, okay, they really grip the ground, they are fall risk, okay. Funny enough, some few days ago, my wife and myself, we went to one of the stores, the big stores, and I said, oh, I need to change my work shoes because and we're looking at them. I said, whoa, I saw one that actually was done to help to grip the ground well cushioned and etc. You need to start making adjustments depending on your occupation and what you, even your age, to make sure that you have that propensity for falls. Motor vehicle crashes, okay, involving driver, passengers, people passing by, trying to cross the street. Contributory factors include cell phone distractions. That's why I say put your phone down. Okay, don't wait until you kill someone before you know that you don't have to be driving and be texting at the same time. Impaired driving, whether it's use of alcohol or drugs. Not putting on seat belts. Not putting on seat belt doesn't mean that you are macho. It just means that if the car suddenly stops, you're going to fly out of the windscreen. That's what windshield. That's what's going to happen. Okay, and which is not necessary. This shows us the fact that especially black males, are really at high risk for drug overdose, and we need to know about that. This is not just talking about native born, but also about blacks generally. Chronic obstructive pulmonary disease, talking about COPD, is a sixth leading cause of death. Okay, smoking is a risk factor for that, but also people can have underlying conditions that increase their risk for that. So if you have that, you want what, even though it cannot be basically healed medically, but it can be managed. It's not curable, but it can be managed. And there are good medications that people have now that you need to sit down with your doctor to make sure that you have those given to you and that you use them. Also, healthy habits that you have to keep to help you be able to build better and extend your life. Talking a little bit about prenatal care, we found out that, using an example, most of this data from New York City. New York City is a melting pot for everybody in the world. So it's a good example where to talk about immigrant health. Found that those that are pregnant in New York City who are born outside the United States are less likely than those born in the United States to go for prenatal care. So when people come, please tell them, encourage them in your churches as a friend. If they are pregnant, they need to go for their visits. Okay. Also, we found that those that have been in the country for less than 10 years are less likely, okay, to go for their prenatal care compared to those that have been there for more time. So it just means that we need to remind ourselves, we need to encourage one another that these visits are not a luxury, but they are necessities to help us get better outcomes. It's amazing that the mortality for maternal mortality is very high in blacks, even in this country, even though we have high technology and advancement, is still very high. Hypertension in pregnancy, pregnant immigrants are less likely, okay, 30% to report preeclampsia. That's blood pressure during pregnancy, or eclampsia, which is seizures during pregnancy, than those that are born here. But wait, compared with immigrant mothers overall, pregnant people from sub-Sahara region and Caribbeans are more likely to have any of these conditions. So when you see people from sub-Sahara that are pregnant or with Caribbean, let them know that they are at high risk for this. That's the reason why even before you get pregnant, try and make sure that you have your blood pressure controlled. And if you have a history of blood pressure, that's when you are pregnant, it's not a time to joke with your blood pressure, because these things can kill. Preeclampsia, eclampsia can kill during pregnancy. Depression in pregnancy, I need to talk about that, even though time is fast spent. Pregnant people born outside the United States are less likely to have depression during pregnancy. However, okay, mothers from sub-Saharan Africa, okay, and South Asia are twice as likely as all immigrant mothers to have postpartum depression, okay? I know we're happy when people give birth. I know we want to make sure that they ginger up, make them happy, but we need to pay attention to people when after they give birth, because people many times are going through postpartum depression, and they may be afraid, or even may be afraid or not fully forthcoming, showing that to show that they have postpartum depression because of the fact that everybody says, "Oh, what's wrong with you? You should be happy," and etc. Yeah, it should be a happy time, but it's a condition, and so we need to be more sensitive in our as friends, in our churches, and etc., to see whether people are going through that and be of help at this particular time before something catastrophic happens either to the mother or to the baby or both. So those, it is found that those that are less than 10 years or more are likely 15% than those that more than 10 that have been here 10 years to have postpartum depression. They also noted that lack of social support was strongly associated with postpartum depression. I would advise you as an immigrant, when you come in, try and be in the social setting, whether it's your church, whether it's your mosque, wherever it's your social setting. Be engaged. Don't be a loner, because it could be deadly in the country. And for those of us that are in social setting with people, let us also be aware of their emotional state. How are they doing? Okay. Yes, they had a baby and they think they should be happy, but it should not be forced happiness. You should find out how the mother is doing. How are they coping with the stress and the demands of being a new mother? Those are important things. As you can see from this diagram, you can see the two here, 20 and 27. Those are those from sub-Sahara in terms of postpartum depression. Yes, they don't have much depression during pregnancy, but postpartum depression, very, very, very pronounced. So assault on immigrant mental health, okay, based on all the things that are going on now, okay, where there's fear of deportation, recent violent and dehumanization of anti-immigrant rhetoric all over, we see that all this play assault on mental health of immigrants, including increasing postpartum post-traumatic stress disorder, depression, anxiety, and even adjustment disorder for those that are here as immigrants. One thing they found out during COVID, which is not far behind, just a few years, is they found that a high proportion of undocumented college students were suffering from anxiety and depressive symptoms. Okay, this was magnified during the COVID pandemic, and this is what they're showing here. So I'm just going to talk a little bit about if you are coming in as an immigrant and you need to, or visa status is changing, I need to go for immigration medical evaluation. What does this entail? Well, it's usually conducted by what they call a civil surgeon, where it doesn't mean that they have to be a surgeon in terms of what they call surgeon. That's what we call a doctor that the country gives the privilege to check you out to see how healthy you are before they can admit you as an immigrant legally into the country, or your status, or change your status of a visa. So the main goal is to evaluate and to assess for conditions that might make someone ineligible for a visa or green card, including communicable diseases, mental health concerns. The exam typically involves medical history review, physical examination, and possibly they'll test you for specific diseases like tuberculosis and syphilis and things like that. Okay, they have this what they call I-69 medical form, and it's conducted to include the things I've said. One thing you should know that the exam also verifies to see whether you have received the required vaccination, because they want to make sure that you don't bring diseases into the country. It's going to include a physical and mental evaluation, drug and alcohol screening, a review of your medical history, and tests for various diseases and illnesses. Okay, it's nice to have a full copy of your medical history, your vaccination and immunization records, your government issued ID so they can know who you are, funds to pay for the medical exam, and of course you have to book an appointment. So in terms of vaccination, the things that are important are things like you want to see that you've been vaccinated, you're either immune, in which case You're going to show tests that shows that your titer is telling them that you are immune, or you have been vaccinated against mumps, measles, rubella, polio, tetanus, okay, pertussis, that's whooping cough, Haemophilus influenza type B, and hepatitis B, okay? So annual checkup and physical checkup. So I'm going to talk now about prevention, okay? So how do we stay healthy? I'm going to wrap up with this. So annual physical checkup. Want to live health and healthy way, healthy eating habits, and live active lives. Want to make sure that we do our cancer screenings. Want to be sure that we are up to date on our immunization, and also want to know how to manage stress. The truth of the matter is that we live in a developed country, and it brings its own stress. Even though we have many things to help us, now we can call Alexa to do this, Alexa to do that, but there are also other stresses that do come by virtue of living in a developed country. And even those that are living in undeveloped country, wherever country, I just found that the world is stressful generally. And of course, good hygiene, because there's still infectious disease that kills people. So good hygiene is important. So one of the things I just want to highlight is annual physical and annual checkup. They use them interchangeably, but they are not actually the same thing. So the annual physical is more comprehensive. It's hands-on. You want to assess your current health status and include screening and lab tests, okay? The annual checkup is just like a wellness visit. We want to see you, like some things that you people do on at your place of work, where you just go in and 20 minutes they're done with you. Are you doing this? Are you doing that? And that's just annual checkup. What you really want is an annual physical. Okay, you want someone that can check you thoroughly every year, and based on what are your conditions, your doctor may even tell you that you should be coming every 3 months or every 6 months. That will be determined between you and your doctor and based on your health status. So this is just talking about the same thing, differences between annual physical and annual checkups. But many times people kind of bring all of it together, the two together, and the main thing is that you want an annual physical where people can check you one time a day, one time a year at least, that you go. It may take a week for everything to be completed, or even a month. But you want them to check you and make sure that everything that needs to be done is checked, your screening, your test, your medication, and etc. Healthy living an active life, okay? Healthy living a healthy outside starts from the inside. So living an active life, healthy eating, good sleep hygiene. We need to sleep well, okay? Many people are sleeping 2, 3 hours, 4 hours consistently. That is not good. Studies have shown that actually impacts on you, your cardiovascular health and otherwise, and your mental health. Social and community engagement. You need to be engaged in your community, okay? It's good for your health overall and good for your cardiovascular health. Avoid smoking, limit your alcohol use. Vaccination, you want to make sure that you're taking your influenza vaccine, flu vaccine, and H1N1, that's the COVID vaccine, is also there, okay? Pneumonia vaccine, there are different types. Your doctor will tell you which ones and in which order you should take them. But eventually, if you have chronic disease like asthma, COPD, diabetes, liver disease, it's important that you have your pneumonia vaccines. HPV vaccine, we talked about that. It's not just recommended for girls alone, it's for boys also, okay? So that they can get HPV virus out of their system. Tetanus vaccine, you should have that done and have a booster every 10 years. And shingles, the CDC recommends that you take shingles vaccine for people that are age 50 years and above. You do not want to have that nasty rash, okay, before you learn. It's just 2 shots taken 2 to 6 months apart, okay? Then there's this other virus, respiratory syncytial virus, which actually causes about 160,000 hospitalization every year. You may have seen the advert, RSV. Yes, it's recommended for people age 75 and above, but if you have heart disease, weakened immunity, severe diabetes, and living in nursing home, yes, you should actually be getting it from age 60 to 74. And according to the American Lung Association, you should actually start from age 50. Healthy. This is the way your plate should be. Okay, you can see the amount of vegetables that are and proportion in your plate. That's what it should be. You should try to avoid eating late at night, avoid drinking too much sodas, and of course, avoid frequent fast food. Active lifestyle. These are some of the recommendations that the CDC has in terms of your health, how to be physically active. But I would say check for the allowed activity level with your doctor before you embark on any exercise regimen. You always want to do that. You don't want to overdo things and kill yourself. And you want to start slow and start low and work up gradually. Emotional health, develop a quiet time. Okay, it helps to set your priorities in life. Worry and stress, the compression is important. Bible says that be careful for nothing, but everything by prayer, supplication with thanksgiving, make your request known unto God. Okay, Jesus Christ said in Matthew that how many of you by worrying can add more to your height? Worry doesn't help you to solve problems, it just puts you at a disadvantage in solving your problems. Spend more time on healthy relationship, whether with your family and friends. Don't be a loner. Bible says that he that must have friends must show himself friendly. You have to learn to cultivate. You don't have to be an extrovert for you to cultivate friendship. Spend more time in helping others also. Matthew says the Son of Man did not come to be served, but to serve. Let's learn to let our life be a life of service. It will help you emotionally and your mental state. Avoid overactivity and overcommitment. You don't have to say yes to everything. Okay? I can do all things doesn't mean you must do everything. Don't be ashamed to seek help if you are depressed or have suicidal thoughts. Okay? We are here to help. People are here to help. And have your Sabbath. Okay? Have adequate sleep and have a day of rest. Your Sabbath may be a Monday, maybe a Tuesday, but find a time that you have rest. You can't be working 7 days a week, 24 hours, 7 days. That's not good for you. Even God, the Bible says God rested. If God is resting, you ought to rest. Take care of your body. This is the only place you have to live in. Thank you all for that. And that will end there. And if you have any questions, I'll be glad to answer them.
Thank you, Dr. Fagbemi, the great speaker. Has been a very, very good presentation. Yes, we have some questions on the chat box, but please, if anybody has questions, please raise your hand. Mommy, you raising your hand? So raise your hand or put it on the chat box. So one of the questions asked from the chat box is, actually, I want to start from the last one. It says that, can you comment on the type of policies that could improve immigrant access to preventive health services?
Sorry.
Want me to read it again, sir? The question is, it said, can you comment on the type of policies that could improve immigrant access to preventive care services? What can immigrants do to access all these cares?
Okay, well, first of all, if you are privileged to have a place that has health insurance for you, that's where you should start. Many a times, people have health insurances and they think, well, thank God for health insurance. When I'm sick, I will go. No, whether you like it or not, you are paying for it. Okay, whether you go see a doctor or not, you are paying for all this dental and medical stuff. So if you have coverage, well, first thing I would say is find a primary care physician. Either ask from your friend or check around your neighborhood, preferably around your neighborhood, so it will be easier for you to keep your appointment. Or if you are lucky, you work in a health establishment, well, choose one of that. So the first thing is choosing someone that can direct your health activities. That's where everything starts from. So that's where I will start from. Now, if you don't have insurance, then you may find that you might be in a community whereby that's why I tell people that when you come to a new place, don't just be a loner. Maybe see your church or your mosque, whatever community you are in. There will be someone that probably you can meet and talk about your health. Maybe there's a doctor there, a nurse there that will be able to help you to navigate the health system. That's what I would say to start with. Of course, there are some other bodies that help immigrants. I don't have the names of those organizations at the top of my head, but I can make that available later on.
Thank you, sir. So if anybody still have questions, please contact Peter Abigail Foundation. We will help you talk to the direct person. Then another question, sir, it says that, will you recommend a pap smear for a 24-year-old female who is still a virgin?
Well, I would leave that to the OBGY. Okay. I will leave that to the OBGY. Because as a doctor, we talk to people, and it's amazing, different kind of activities that people do that may put them at risk. So I wouldn't say that you should not do any pap smear for someone based on the fact that they decided they are virgin. Okay. Of course, they can't force you, but you should sit down and have a sexual history, a full sexual history encounter with your doctor to determine whether you really at any risk or not.
Thank you. Please, as you're saying, if you also have questions, please indicate or put it on the chat box so that we'll read it. These questions has been answered, but I still want to give us more information. You say that what is OGTT?
Yes, sometimes OGTT is oral glucose tolerance test. So sometimes when they send you for blood tests, first of all, there's, like I said earlier, they will check for your hemoglobin A1C. They want to see what your fasting level is. So if during that time they find out that you are like what we call borderline, which means that we call it impaired glucose. That means your body is not really not hit the diabetic range yet, but it's not handling glucose well. Then they might want to do what they call a challenge test, whereby they give you a certain amount of glucose, and then they start monitoring what is your glucose level 1 hour after you take that glucose, 2 hours after you take it, and etc. And based on the levels that they get, they will tell you, okay, well, yes, this is not working right. This person is like diabetic, and we have to start treating like diabetes. But also they can use that, or they also use that for people when they are pregnant, because you want to try and diagnose whether they have gestational diabetes. So they give you some sugary things to drink, and then they monitor your glucose level, and based on that, they will find out whether you have gestational diabetes, and then your doctor can now chart a course on how to take care of it, because they know that if it's not done well, it can affect the baby and even you and the pregnancy process. So that's what OGTT is.
Yeah, thank you, sir. Somebody mentioned something on shingles, but I think you mentioned that already.
The shingles vaccine, yes. So if you are 50 and above, you should have it. Funny enough, my wife and myself were talking about the fact that we need to go and get our second shot. So within the next 2-3 days, we're supposed to go and get our second shot. If you have not had shingles, please, and you're that age, try and get it, because you don't want to learn from having shingles. It's not only is it bad when you are having the rash, but sometimes you have complications after the rash whereby the pain persists. Post-hepatic, neuralgia, you have this pain that stays there and doesn't go, because what happens is that you've had chicken pox before and that virus has not left your body. That's actually what happens. It's in your nerves. The only thing is that your body has immunity that's been keeping it down. And as we get older, our immunity decreases. So what happens is that a time comes when your immunity is not enough to hold that virus down, and then it comes out. And then you have that. So, and that's also the reason why we need to be checking our health every year, because you are not the person you were 2 years ago. As you get older, our immunity changes. We have to constantly reassess our health status and make the appropriate adjustment. So basically, it's two injections to be given 2 to 6 months apart, and that takes care of it. I just read something recently that actually that injection has now been found to reduce for those that are 60 and above, and even those that have diabetes and poor health. They've found that taking the shingles vaccine reduces their risk of cardiovascular events by 23%. That's substantial. Okay, so if you've not had it, I would advise go to your doctor, talk about it, and have it. They also once you're eligible, you don't even have to go to the doctor's office. I get mine from CVS. Most of my vaccines I get from CVS, apart from my flu vaccine that maybe sometimes I get at work. Other vaccines that are available, I get from like CVS, the pharmacies, and Walgreens, and they are paid for by your insurance too. Okay, and you can always make you can make your own appointment. You go online, you choose the time that you want, usually many times, and you can choose one that's convenient for you, and you just go there like 15 minutes before time, get your vaccine. They'll observe you for some time, and then you can go home.
Thank you, sir. Somebody gave an update on the shingles vaccine, sorry. So that
yes.
Brother who is 70-year-old got the shingles and was so sick after, even 4 months after. You see how the side effects.
You mean the vaccine or the shingles?
So he's got, oh, okay.
Oh, he got the shingles, yes. So it's just telling us the fact that, yes, the person is just reiterating what I said, that it's not just the effect that you get during the time where you get the rash. After the rash is gone and it's dried, you can still have complications from it that are lasting. Remember, those viruses are inside the nerves. So even after they've come and gone, it's not like a flu. It's not like you that have flu that, okay, well, oh, I take care of the flu and after 1 or 2 weeks it's gone and the flu is gone. No. For this virus, it stays in your nerves. Yeah.
Thank you. Somebody asked this question about black folks who doesn't, because of our skin, we don't go to dermatologists, and we don't use screen skin. So
thank you very much. Do you know that one of the most common #1 cause of cancer? That's why they tell you when they're talking about what's the most common cancer. They say apart from skin cancer, the #1 cause of cancer is this. That means the #1 really is skin cancer, and it occurs a lot. And because it doesn't have much depth for it to go into other tissues, you need to get it early. People have this erroneous idea that because we have melanin, yes, it's true, it does protect us to some extent, but they think that it's a free pass for skin cancer. That is not true. You need to check your skin. That's why when you go to a doctor, don't be annoyed if your doctor is doing the right thing and saying you should put on a gown so they can see your whole body. It's not just about checking your lungs and etc. alone. Let them check your body to see if you yourself see something abnormal on your skin. Show it to your doctor, okay? Because if they think it's cancerous, they can always send it to the dermatologist, and they can take a biopsy and get it and know what's happening on time and take care of it. Otherwise, if it's too late, it will have gone to other parts of your body, and you don't want that. If you're having a sore that's occurring on your face and it's just going there and even trying to expand it might be a basal cell carcinoma. Don't just overlook it and say, oh, this nasty thing, I don't know why it's still there, and be rubbing balm on it. No. What I'm trying to say is that as Black people, you don't have a pass on skin cancer. Check your skin very well. If there are molds that are changing their colors on your skin, if there are things that have also that are just there and suddenly you don't know what's going on here, this thing is expanding or changing color on you, let your doctor know so they can do something about it.
Thank you very much. Another area I want you to just delve into is this social settings. How do we come? Because we know one thing, most of us come here is like, we immigrants, we are here for something. We can't, it's work, work, and work, and work. We work, even when we are free, we call the management.
For overtime.
Yes, overtime. Say, do you have overtime this weekend? I want to work. And you're talking about social settings. How do we regulate both of them? Yes, we need to work. We come here for something. We want to make more.
I'll tell people, I remember when we first got to this country and we used to tell people that we're going on vacation. And people used to look at us as vacation. You're going on vacation? But people have come on board now that, yes, you need to go on vacation. You can't just come and be working, work. You have to have time. Plan your life with your family. Summer is here now, okay? Take your kids, and the good thing about it is that it doesn't have to be expensive. You can go, the weather is good, take your kids to the park around you, play with them, go to the museum, go to, they have many, what they call it, national parks and etc. all around where there are trees and etc. You can just go to Central Park, okay? It will just cost you, if you're in New York City, just go to, I'm sure in other states they have other parks too there, but go to Central Park, it just cost you the fare of a train ride. You can always what they call it, transfer. So go there, spend some time, okay? Make an habit of planning time for your family, for yourself to rest, okay? But also, Bible says rejoice those that rejoice. You see, many times we don't follow what the Bible is saying. That's part of social life. Okay, that's how we maintain our health and sanity, not just individually, but as a group. Learn to rejoice with people. Learn to be part of what people can do as much as you can. Don't overburden yourself. Part of what church is, what makes people happy is not just the fact that we preach and we share Bible study, but the fact that we see each other, we discuss about things. That part I do not discount it. It doesn't make they talk about, don't make church is a social club. Where it's a social club, but more than that. Okay, the people in the Bible, one of the things that made them also relevant to where they are was the fact that they were sociable with themselves, and they were able to impact their lives together. So we need to not underestimate the importance of being social in our lives.
Thank you. Before we go, please, you said something I just want you to, just because you just mentioned it, I want you to elaborate on it, and that is to say, health is not valued until sickness comes.
Yes, it's unfortunate that many times we spend time and all our energy trying to get money only to fall sick, and the money we think we have accumulated, we are now using to treat the disease that has been going on in our body all through the time we're chasing money. You can chew gum and ride bicycle together, okay? Like we said, I can do all things doesn't mean that you must do everything. Life is about balance, okay? No, you should work. Bible says he that does not work should not eat. Yes, you should work, you should spend time, but you should do everything in balance, okay? Have time for your family, have time for God. When we say have time for your God, I tell people most of the time that we say have time for God, really it's not God that we are really helping. It's ourselves. You have time for God because when you have time for God, He talks to you and tells you what to do. If that's how your own time with God, because some people time with God is just telling God what they want. But part of it should be it's a two-way. You talk to God and let God be able to talk to you and say, you know, this part of your life you need to change. This part of your life you need to do things. That's how God talks to you. God has to tell you slow down or do this. That's part of what you call quiet time, you know. So having time for God, having time for your family, having time for your vocation, you need to make sure that you get better in your vocation. Bible says, talks about that says that a man diligent in his business, he shall stand before kings, shall not stand before ordinary men. That means diligence. You have to spend time to improve yourself. All those things are part of life, and you just have to have time for each part of it to be a well-rounded person. So that would be my admonition for everybody. So let's not spend all our time chasing money only to the detriment of our health, because then we don't have the time again in life to enjoy the money you have accumulated, or the money you have accumulated is now used to be treating the disease that you have avoided.
Thank you very much. In case nobody has any more question, okay, so I want to thank our guest speaker today, Dr. Moronkeji Fagbemi, for this wonderful presentation.